the Compassion Fund being named after Dr. Rhoades is really important because he has left behind a legacy in our department, and I think this will allow us to carry that through. It will allow patients who didn't get the opportunity to know him and know what he stood for and know what he was about. And it also reflects very well on the care that we strive to give to our patients every day.
The Cancer Care Navigator's role is to support patients, basically helping them get through their treatment. In addition to sometimes it's psychosocial support and just listening, and through that journey we sometimes get posed with some of the challenges that patients and their families are having.
Some of those issues, we have practical solution, but there are many things that we have no answers to. Transportation is probably the #1 issue for our patients. Many of our patients are coming for treatment for radiation therapy 5 days a week for 6 to 8 weeks. Many of our patients come from Marshalltown. Many of our patients come from Boone, Carroll. And if we could help up front rather than saying, gosh, I don't have any solutions, I don't know how to help this person, that would be wonderful.
That's what I think we're striving to accomplish with the use of the Joe Rhoades Compassion Fund. This will just make it a little bit easier to make things better for patients and families.
He always would tell us, this is long before Mary Greeley's tagline became doing what's right. We often heard that out of his mouth. It was the right thing to do for that patient.
A lot of times, and they've been in treatment for so long, it becomes so much about the illness, and it's very easy to talk about nothing but the illness. But he always came in and was, happy and always made, personal comments, and I thought it was just a great way to kind of remember the person.
When he talked to you, he made you feel like you were the most important patient that he ever took care of. Everybody's story was important. He made you feel that way.
Dr. Rhoades was one of the best doctors that I've ever worked with. He just was the most compassionate person, and most of all, I think, everybody knows him for his joking.
Dr. Rhoades started in our department on April 1st, April Fool's Day, which anyone that knows him would tell you that was a perfect day for him to start in our department.
He was a jokester, he was funny, and I miss his humor quite a bit.
Just his jokes, and people could kind of escape, because obviously our patients coming through have cancer and everything is hard and it's very serious, and for him to just be able to lighten the mood, everybody, all of our patients loved him. He just, such a kind, funny person, and I wish he was still here, because I just go up and give him a big hug, because you never know when somebody's gonna be gone.
One of the things I love about this fund is that it is in keeping with his spirit of dedication to patients and taking care of them. I think that would be in keeping with his spirit of generosity. He was a very generous man.
He gave so much of himself every day. This kind of fund is exactly what he would want to support, and exactly what exemplifies the type of person and the type of physician he was.
He was a great mentor. He actually was just a fantastic advocate for patients. Every aspect of the care that we delivered, he made sure that we were doing the right thing and that there was not administrative barriers that were going to keep us from doing the right thing. One thing I learned from Dr. Rhoades is how important it is to just remember that this is a humanistic type of a situation where you're treating cancer. I think people have this sense when they come into a cancer clinic that it's going to be a grave conversation and it's going to be very somber and dry. And he would talk to people after their therapy and say, well, like a cockroach, we haven't killed you yet. It just totally changes your entire perspective on what's important about life and keeping your perspective. And he had such a rapport and an affinity with patients. He was just well loved. And I would have some of my patients see him because I was away at a conference, and afterwards they would just get a smile on their face, say, I really like that guy, he was great. I think it's very appropriate that the fund is named for Dr. Rhoades. He's been an advocate for the Rhoades Cancer Center and for this particular fundraiser for years. When I first came here, he said, we have a tradition in our department of inviting the staff to participate in this, and then we pay for the tickets. So I'll make sure you get your bill. And so that's pretty much how he said it to me, and I had no argument with that. He has always been an advocate that we look at the whole person and that we consider challenges in an individual's life that may be outside of their medical history. And so to be able to support them with transportation or lodging or whatever this fund can cover to help people that their insurance is not going to cover, that would be very appropriate.